Omicron, of course, all across the news still. New rules came into force in England at 4 a.m. this morning with regards to mask wearing, which is now mandatory again on public transport and in shops in an effort to slow the spread of the new variant. Now, the South African doctor who first alerted the world to this new Omicron variant has said that so far the symptoms seem mild, and she says, and I quote, "This doesn't warrant the knee-jerk reaction we have seen from the UK." So what do we think about these new rules? You know, are the government being responsible? Sometimes, Janet, they're between a rock and a hard place, because if they do nothing, everybody complains. If this variant suddenly ran riot and they said, well, they did nothing, and now they're doing something, people are saying, oh, it's a knee-jerk reaction.
I think it is an overreaction because there's going to be a real problem enforcing mask wearing. I have no problem with wearing a mask if someone demonstrates to me that wearing that mask will halt the spread of COVID. But at the moment, 90% of the population have got COVID antibodies, 80% of us are double jabbed, and I just think that wearing a mask, OK, persuade me to wear a mask again, because I have been religiously wearing a mask on public transport throughout because the Mayor of London said it was mandatory to wear a mask on London transport. And yet every week I go on the train and I would guess that 1/3 of the people on public transport are not wearing masks and have refused to wear masks for the last few months. So who's going to enforce the mask wearing now? They say the police are going to enforce it, but the police are stretched anyway. I mean, this is
you're saying about the efficacy of masks. I mean, there are various studies, and don't blow up yet, Denise, I tell you this, but it says here, you know, various studies say that they do block up to 80% of droplets from escaping into the air. The World Health Organization say masks should be used as part of a strategy using other measures. Masks alone are not sufficient, but there is some evidence, it seems, that masks do help in suppressing the transmission.
Like I've said, and I have never in the history of my 63 years put myself on the line, you know, like I have with this whole pandemic, because I've been speaking out publicly about it since the beginning. And it comes from the mental health perspective. And the thing about masks is, I will die on the mental health hill, I will not die on the mask hill. But the point, and these are questions, all I've ever wanted to do is ask questions and have the questions be answered correctly. And one of my questions about masks is, why are people saying now, and I've seen a lot of people on television this morning saying, well, we shouldn't have let the mandate go. We should have kept the mask mandate going completely. Well, A, why are some of the countries that have had masks mandated outside and inside got some of the highest rates of COVID? Not necessarily hospitalisation and death, but as regards cases. And the other thing about masks is that we at the moment in the UK have one of the lowest rates of hospitalisation and deaths that we have had for months and months and months. So therefore, why should we have kept the mask mandate? The other thing is, if masks are carrying the deadly virus, we know COVID can be a deadly virus, you know, I'd like to say as well, I've just seen my dad die of an upper respiratory infection. I wouldn't wish anybody on that. So for anybody that wants to say about the COVID denying, it's utter rubbish. This is from the mental health perspective. But we're talking about pieces of cloth. On the blue masks, we are told on the box that they don't help with viruses. Also, the way we use masks is that we have the cloth masks, they're on the table, they're in our pocket. They fall down, we pick them up. They are about as much use, the way most people use them, as a chocolate fire guard. If we were all fitted with these, you know, those really sort of safe masks, that may be a different thing. So what do you think?
It should be personal risk assessment. So if you feel that you're vulnerable, if you feel safer wearing a mask...
It's become a political thing, Ruth.
It's become political. We've got a Prime Minister who doesn't like wearing a mask. He's not exhibiting the kind of leadership I think we need. And as long as... Look, there he is yesterday, not wearing a mask.
But I think that's OK. Boris is there. I Instagrammed this yesterday. My point was, have a great time at lunch, Boris, as all the children on Tuesday, obviously not today because COVID's not going to happen over the weekend, but on Tuesday next week, let's put all the children back into a mask. Now, the absolutely vehement people who like masks, and I have nothing against their opinion, you know, and whatever, but they say it's only a mask. It's not only a mask for children. Children rely on faces. They're having their nativity plays cancelled. And I also want to say this as well, because you've all heard me on the phone to someone this morning at a hospital in the Northeast. I've just shown the producers the dialogue I've had with medics. People think that I get my information from Joan from Facebook. I don't. I actually speak a lot to lots of very, very important medical people and infectious disease doctor. I'm not going to say, but I've shown you the people. And they feel very strongly that there has been a massive, immediate overreaction to this. These nurses I've just spoken to this morning at the hospital in Middlesbrough have said, we are so peed off, we cannot tell you. We are already desperately trying to navigate around COVID protocol, which means stopping people being with their loved ones, being with them in ambulances like I would stop. How dare they, on a knee-jerk reaction until we know more, put us in this position again, that at Christmas time, we are going to have to say to somebody, it's you or your sister can be with that dying person.
I agree. I mean, I listened to Denise's rant and I go, that makes sense to me. Equally, when you read stuff out, it makes sense to me. I have to believe the scientists and the doctors. I have to. I don't know enough myself. You just made a point there by saying the UK has one of the lowest rates and all of that. Yeah. Well, if that's true, maybe that's because we have done it properly and followed the rules.
And we opened up. But loads of people are not wearing masks. And the confusion is only going to get worse. Last night I went to the theatre. I stood in the bar, no one's wearing a mask. Before the play started, suddenly they're saying, put a mask on. Tonight I'm going out and I've already had two. The change and the advice about what to do is changing by the minute. And looking down at the list of people they've issued, places they've issued today where you've got to wear a mask, estate agents, auction houses, tattoo parlours. I mean, who is getting paid to come up with this?
Children waiting on the mental health list. A lot is pandemic-induced. We have a mental health pandemic, which nobody is addressing. Let's have a conference at night about the 50,000 cancers that are going to be undiagnosed because of this, about the starvation because of the hunger chains that have been stopped all over the world. I just am so irate about it. Sorry.
I think we can tell.
You can tell.
Wow. You're allowed to be on here. That's why we're here, to discuss these things. Well, I think, like Colleen said, you know, all through this pandemic, we have interviewed so many people, and we could have two very eminent scientists here, medical professionals, and they could have completely opposing views on mask wearing or anything. And that's what I find confusing. I
find confusing.
I'm not a medical professional, so which one of those do I believe?
Sadly, the ones who don't go with the government.
Anyway, just to reiterate, the new rules from today in England, this came in at 4 a.m. this morning, will be required to wear a face mask in shops and supermarkets and on all public transport. There is a list, as Janet said, of other things, but mostly the two main ones, supermarkets and public transport.
Yeah, and remember in the auction house.
So she's still on.
Yeah, extrapolating.
Yeah.